We humbly present to you our product prototype, the U-dent brush, a home oral health care for patients with cerebral palsy. This innovation is driven by our respected Dr. Ilhamwan Mohta. Steering the wheel is Farha Nasrin Nasaruddin, together with her esteemed colleagues. Cerebral palsy is a disorder of movement and posture caused by non-progressive abnormality of the immature brain that originates during the prenatal or perinatal period or first few years of life. This results in significant impairment of functional mobility. Four major subtypes of cerebral palsy are spastic, dyskinetic, ataxic, and mixed cerebral palsy. Spastic forms were reported to be the most common. In 2012, Ministry of Health registered 215 cerebral palsy children. 22% from 900 disabled children had cerebral palsy. Prevalence of cerebral palsy in industrialized countries of between 2 and 2.5 per 1,000 live births. The real number in Malaysia may be substantially higher. In 2017, the Malaysia Department of Social Welfare registered 453,258 people with disabilities. Clinical manifestation of cerebral palsy includes intellectual disability, seizure disorder, delayed motor development, limb spasticity, persistent primitive reflexes, and involuntary movement and ataxia. The reported oral manifestations that are exhibited in cerebral palsy patients are enamel hypoplasia, dental erosion due to gastroesophageal reflux, delayed eruption of permanent teeth, dilantin hyperplasia for those with epilepsy, increased incidence of Class 2 Division 1 malocclusion, increased risk for oral trauma and injury as well as cleft lip and palate, tongue thrusting, mouth breathing, and tendency to store food in inner cheeks due to inability to swallow or food pouching. Here are some facts about children with cerebral palsy and their oral care that you might not come across. While 40% of the study's participants' children without the disorder had regular dental visits, only 23.6% of the children with cerebral palsy had seen a dentist. Cerebral palsy patients faces challenges to maintain good oral health as they may be presented with physical and mental inability. They rely heavily on their caretaker to perform day-to-day oral hygiene routine. This is due to their insufficient jaw muscle relaxation, hypersensitivity of the mouth and tongue, difficulty gripping toothbrush and floss, unable to spit and swallow, and hyperactive or hypoactive gag reflex. So, how do we aid in tackling these limitations while maintaining efficient oral hygiene practices among cerebral palsy patients? Fret not. This is where our U-dent brush swoops in as a savior. What we were aiming to get out of this innovation is to deliberately help with their oral hygiene routine and care at home, to promote and instill positive attitude towards dental hygiene, and to reduce risk of caries and periodontal diseases whilst helping to improve quality of life for both cerebral palsy patient and caregiver. Powered by two AA batteries, our U-dent brush is equipped with U-shaped tray brush whereby the bristles cover top and bottom within the tray and is connected to an electronic vibrating motorized tool as well as a suction pump. It vibrates in the motion of vertical, horizontal, and lateral, which ensures all surfaces of the teeth are free of biofilm with just a flick of a switch. The suction pump is hand-held outside by the caregiver to suck out water or saliva to ensure no pulling in the mouth occurring during the process. You may wonder if it is safe to use a battery-operated toothbrush for your child with cerebral palsy. No worries! A study by Pennick stated that powered toothbrushes are safe to use as manual toothbrush. A study from Bosker et al. Found that electric toothbrush was significantly superior to manual brushing. Therefore, the usage is highly recommended among neuromuscular disabled people. Hope that with this, it could ease you in using our U-dent brush in your daily oral routine care for your child. Let us see the product in action. Turn on the power switch. This, in turn, powers the vibration of the U-shaped tray. The suction gun sucks out all the water and saliva into the reservoir and should be discarded before the next usage. These are three of the many benefits from our product, which are: it improves brushing technique and enhances oral health-related quality of life. Next, it creates a cleaner and more comfortable environment, as it has a suction pump that could be gripped by the caretaker to assist in decreasing gag reflexes or aspiration pneumonia caused by saliva and water accumulation in the mouth during toothbrushing. All in all, this prototype could help motivate caregivers in delivering proper oral health care, as it mimics best method of toothbrushing, whereby assisting in improvement of brushing technique. As this is just a prototype, we were aiming to incorporate some improvements in the future for smooth running of the product. It includes variety sizes of tray brush to accommodate individuals of various ages, custom sized tray brush to have better vibration system and movement throughout the tray brush, a smaller and concise device, wireless charger deck, an automatic suction gun, and an app control device. In the current market, the readily available similar type of brush, which is the Y product, only brushes one arch at a time, and individuals still need to manually spit. With our product out there, it creates a competition as it has a dual function. It brushes both upper and lower arch in one single sweep and could suck out water and saliva without individuals needing to spit. A two-in-one product. Another similar competitor, the G product in the market that comes with suction hole at the tip of the electric toothbrush, which works similarly to suck water out. As you could see, the G product only brushes one section at a time. This could take considerably amount of time if it is used in patients with cerebral palsy, and thus decreasing the caretaker's motivation in giving proper oral care. In hopes that with the U-dent brush, which has a dual action, it could take matters of the caretaker's burden in delivering proper brushing technique. Our invention is unique in comparison to other similar products on the market in terms of feature, material, design, and operating system. It is equipped with portable suction to increase the comfortability and manual portable suction for easy handling. Our U-shaped tray uses bristle brush instead of silicone brush for more efficient removal of the plaque. Cleaning effectiveness is maintained until the toothbrush wear is occurred. Hence, it is consistent with our goal of developing an oral care device that is acceptable for those with unique needs. We are targeting a niche population, mainly focusing on cerebral palsy community. But other target market can also benefit from our products, such as dentists and pharmacy, caregiver of the disability patient, those with poor manual dexterity, child with behavioral management issues, children below 6 years old that is usually unable to spit and tend to swallow the toothpaste, and patients with disabilities who requires constant assistance. And with that, we thank you for listening.